Okay. Hi, guys. My case study is for a left lower quadrant hernia. So the equipment used is the GE Logic S7 Expert ultrasound machine. And then the probe that I used was the GE C15D curved array probe. Okay, so the patient background and history. So this patient was a 55-year-old Caucasian female, and she had no serious medical conditions or history. She did have a history of smoking. She was morbidly obese, and the reason why that she came in is because she went to her doctor, and he referred her to get an ultrasound because she was feeling a lump in her left lower abdomen. And I remember when she came in and showed us where this lump was, you could actually see it, and like feel it, um, to where the pain was. So here's a picture of it. It's pretty big. Um, you see here, and it's the left lower quadrant. And then we did left lower quadrant abdomen with strain. So you do with strain to kind of see if the bowel comes out. And you can kind of see here in these pictures, it looks like a mushroom or like a volcano explosion. I don't know. It's kind of hard to explain, but you can kind of see it looking like that. And then with the strain, you can kind of see the bowel moving out of it. And then here's just another picture that you can kind of see like the mushroom or volcano explosion here. And then you can kind of see the bowel coming out of it. Okay, so these are pictures that I got from the internet. These are not the pictures that I took, and it's just kind of showing you another way that a hernia can look. So you can kind of see where the hernia is coming out, right here, and you can kind of see the mushroom volcano look here. And then if this person was to strain, you would be able to see the bowel coming out of it. And here's just another look. So there's the hernia, and then the volcano slash mushroom kind of look. And then this is where the defect is, where the hernia actually can herniate out all the contents inside of it. So the sonographer's report, we just wrote possible hernia in the left lower quadrant. The radiologist read it, and so he deemed that it was indeed a hernia. And since it was a hernia, he suggested that the patient would have to have surgery to fix it, since it was, let me go back, since it was pretty big, he recommended surgery for it. So what happened after? The patient was recommended to get surgery to fix and repair the hernia. So I'm not sure if she actually scheduled the surgery or if she decided to wait and get it. Um, I'm not sure if she wanted to get it fairly soon or not. So what is a hernia? A hernia usually happens in your abdomen or groin when one of your organs pushes through the muscle or tissue that contains it. I wonder if I can. Okay. So abdomen or groin, when your organs pushes through the muscle. It may or may not cause symptoms. For the patient that we had, it did cause symptoms. And symptoms can show more when doing exercise or lifting things because you kind of put a strain on it, so you'll be able to feel it more. Inguinal hernias are the most common type, and they account for 75% of all hernias. So that's important to remember. A femoral hernia is a less common type of groin hernia that occurs in the femoral canal, which runs underneath the inguinal canal. An umbilical hernia occurs when part of your intestine pokes through an opening in your abdominal wall near your belly button. So, umbilical, belly button. And just to kind of take away from this, important things to remember. Inguinal hernias are the most common type. Okay, let's see. Sorry, guys. Okay. What is a hernia? Continue, just more facts. So most hernias are surgically repaired, just like the patient that I'm doing this case study on. Hers would have to be surgically repaired. Hernias can gradually, as you get old. Hernias can occur gradually as you get older, and regular wear and tear on your muscles begin to add up. They can also result from injury, surgery, or birth disorder. I actually read on a website that a lot of construction workers or like people like mechanics, people like blue collar people using their bodies a lot are more prone to get are more often to get hernias because they're using their body a lot more physically and wear and tear on their muscles, and so they're more prone to get hernias. Okay, so like I was talking about earlier, this is just a visual to kind of go with the words that I was saying. So the umbilical hernia is around your belly button, inguinal hernia is kind of around your groin, and then the femoral hernia. Ooh, there we go. So that just kind of goes along, and the inguinal hernia is the most common. Let me erase this. Oh goodness. Okay. Sorry, guys. So tips and tricks for ultrasound hernia. This is something that my clinical instructor taught me, and I thought it was really interesting just because I love hearing about the little tips and tricks. But look for that mushroom sign that I was talking about. So earlier, so the little mushroom sign, it's like, looks kind of like this, and then you can kind of see the bowel coming out of it. Look for the mushroom sign or the volcano sign, whatever one's easier to remember. Look for the opening of the hernia and the bowel protruding through it. And you can kind of do this by having the patient do the Valsalva maneuver, or kind of have them like clench up their abs or do something like that to make the bowel move. And when you're looking for hernia, you have to look for the opening to prove that there is an opening and that there's bowel coming out of it. So those are just kind of tips and tricks for looking for a hernia. Majority of the hernias that I've seen have looked like this, so I think those are really good tips and tricks. Let's see here.